Okay, I think we have all of our subcommittee chairs except for Governor O'Malley. But people are still being admitted right now, Dr. Dukes and Dave.
So as we are admitting people to the meeting, we do want to call to order the executive committee meeting of the Prince George's Forward Task Force today, October 14th, 2020. We do want to remind our audience that the meeting is recorded and the recording will serve as the formal minutes. You can always go back and review the recording at www.princegeorgesforward.com. You can also send any questions or comments to pathforward@co.pg.md.us. At this time, I'll turn it over to my co-chair, Mr. David Velasquez, to introduce the meeting and the topics for today.
Great. Dr. Dukes, thank you. Welcome, everybody. Thanks for being here. Thanks for all the work you're doing. The agenda for today's meeting, which was sent out, I think is pretty straightforward. We really wanted to spend today's meeting reviewing short-term recommendations from each of the subcommittees. And I know we have all the subcommittee chairs except Governor O'Malley here to be able to do that. We had asked Dr. Dukes and I that you focus your presentation on, I'll say, the top 4 priorities that you have. We want to make sure as we continue to move forward here that we keep a tight focus on what it is that is most important from your perspective for the county to move forward on. I think it's easy and appreciate the number of recommendations, and we want to make sure we capture all those recommendations that you have, but really wanted to keep us at this point focused on, I'll say, the top 4 for each to make sure they get the right amount of focus and we don't dilute our ability to move forward quickly by having too many recommendations and then getting caught up in trying to do too many things at one time. So that's the agenda for today. And I think unless Dr. Dukes, there's anything else we need to cover in a preliminary matter, we can probably jump right in and move forward. I think, David, you had circulated to everybody I don't know whether it was a PDF file, I believe, that had the visions for tomorrow recommendations listing from each of the committees, right? So everyone has that?
Yes, I did. So it should be in your inbox if you haven't checked it yet.
Okay. And I believe we did get Governor O'Malley on the line. So when it comes to time, we'll turn it over to him. We were just going to follow through. I was just going to follow through with the agenda as it's written, starting with Dr. Pines, who chairs the Education Recovery Subcommittee, and ask you, Dr. Pines, if you could give us an overview of the top recommendations that you and your group have provided, and again, if there's any in the longer list that you just want to make a mention of, that's fine. But really, if we could focus on the top 4, that'd be great. So let me turn it over to you, Dr. Pines.
Thank you, Co-Chair Velasquez and Co-Chair Dr. Dukes. Great to be with all of you again on a Wednesday afternoon. I thank you for putting education first today. I really appreciate that. I want to thank also Dr. Askew and of course Ms. Madison Gray for their contributions to our committee. It's been great working with them, and to all my committee members who have come up with these 4 wonderful short-term recommendations. So let's get started. The first one is positive reinforcement program for youth. So making sure to recognize and provide Prince George's County Achievement Awards for youth in the community who are models for excellence in our community. Not only does this incentivize students from the county to strive for excellence, but it also provides a mechanism for the county executive's communication team to highlight positive stories to our entire county and to the nation. So we call this a positive reinforcement program for youth, and it's a mechanism for incentivizing youth to strive for excellence, but also a mechanism to communicate that excellence and that achievement across P to 20 to our Prince George's County community and to the state and to, of course, the nation. Number 2, because of the times that we're in, the pandemic has changed a number of things in post-secondary admission practices. So this next topic is communicating impacts of taking the standardized test, SAT, or not taking the standardized test, SAT. And so it's in this new context, this new evolving context, that what we're seeing in post-secondary education, that test optional is moving to allow for a greater holistic review of applicants. And this will provide greater opportunity for those students who are prepared for this new test optional environment. Many post-secondary institutions are using it because students could not go to testing environments to be tested. So right now there's an enormous opportunity where universities, community colleges are looking at a more holistic application review, including the possibility of using what we're calling electronic portfolios as a mechanism to review applicants for their entry into our programs. This should lead to more diversity across the county in terms of the access of students to our institutions. So this, again, the topic here is communicating impacts of taking the SAT or not taking the SAT. That's the second one. The third one is expand parent support center program. So not only help with digital needs homework issues, but also help to organize communities in general to support their children. Focus on social, personal, emotional well-being, and academic excellence. It really is an expansion of the community schooling model. So again, the third one is expand parent support center program. And our final one for today is really a continuation of the quick win recommendation that we had mentioned earlier, but now it's really expanded. And we call this reallocate teacher resources broadly. So just reallocate teacher resources. And let me just highlight some elements of what we're talking about. So foundationally, we need to address the gap in learning outcomes, the gap in learning resources across the entire system as a foundational effort. As we examine that gap, it allows us to make, or the county to make, decisions about the reallocation of resources. So for example, in this virtual learning environment, what we've all learned, we've learned this in K-12, we've learned this in post-secondary education, that there are some educators who do really well in the virtual learning environment, and there are some educators who do very well in the in-person domain, and there's some educators who do well in a hybrid domain. So when we speak about reallocation of teacher resources, we're not asking for more teachers. We're saying, well, identify those teachers who do well in the virtual learning environment, identify those that do better in the in-person, and reallocate them to the appropriate modalities of learning in your institution, in your middle school, in your high school, in your elementary school, to be more efficient in the delivery of education outcomes. Number three, because the first one was addressing the gap as it relates to this area. And then as another issue, we think that there's an asset mapping that needs to be done. So for example, some high schools have better laboratories for, say, chemistry or for physics. And maybe if these were activated in a virtual learning modality, that other schools could use those laboratories in a virtual mode to be more efficient across the county, since maybe there are better resources that are given high school across the county. So this is, again, a concept that's related underneath this reallocation of resources as an asset mapping process that would be done across the entire county school system. And then a couple other final things that are related to this: the expansion of the summer youth enrichment program, and then the alignment, as you've done the gap analysis and the asset management, the alignment of digital resources from all county agencies to promote resources through the county to be more efficient. So those are our four topics. Again, I'll just go through them real quickly. Positive reinforcement program for youth, communicating the impacts of taking the SAT, not taking the SAT, expand parent support center program, and finally, the reallocation of teacher resources. Thank you.
Dr. Pines, thank you. And real quick, see if anyone has any questions for Dr. Pines. I have one which was on the SAT. Is the University of Maryland thinking about changing their policy? Is that part of it?
Absolutely. We've already moved to a holistic application review, and we are now looking at electronic portfolios. So we're allowing students to provide additional information above and beyond the application process to tell us what their potential is for being at our institution. So they could submit movies, other artifacts that enhances their application portfolio. And a lot of schools are starting to do this in this virtual domain to give the opportunity for the student to best represent themselves in the application process.
Any other questions for Dr. Pines on these 4 recommendations?
By the way, I just want to put in a selfish plug. We increased the number of Prince George's County residents attending University of Maryland by 15% this fall. So I just want to let you know, we care about the county. Thank you. I'm done.
Okay, if nothing else for Dr. Pines, I will move on to Ms. Rosie Allen Herring, who chairs the Human Services and Social Services Recovery Subcommittee. So Rosie, the floor is yours.
Thank you, Mr. Chairman, and thank you, Madam Chair, as well. And I get to follow Dr. Pines. I tell you, with that last plug, I tell you, you got me. But that's okay, because we're going to take care of Prince George's County, too. The Human and Social Services group does have our 4 recommendations as well. As you know, they were culled from a myriad of other representations or other recommendations as well. Our 4 have everything to do with moving the county forward. First one is coordinating housing support for domestic violence victims, as well as those who are dealing with sexual assault and human trafficking. Now, we do recognize that many of the recommendations that we're making may have some duplication, or there may be some synergy with other organizations, but we thought it best to still bring it forward to say that we recognize we will be partnering with others, that this is not a standalone effort. We believe that if there is synergy around a particular issue, then that makes it a clearer priority for the county executive and for our county's leaders. So when we think about that, it's really for those who are victims of sexual assault, human trafficking, assault victims. We look at our Family Justice Center and the expertise there from individuals who are also working on that side already, and how do we now look at what the expediency, if you will, of COVID, what it has done to that particular subject matter, and certainly for those victims and those individual and families. The second area of focus for us is building out the food czar through GIS mapping. As we've shared before, it was one of our earliest recommendations that we thought as a quote unquote quick win, we had an opportunity to be able to coordinate, if you will, all the various services that were happening in our county. There's been no shortage of ideas. There's been no shortage of small efforts, if you will, but we believe that a collective approach, not taking anything away and certainly not fostering territorialism, it really is about how do we make certain we're as effective as possible, that we're reaching as many families as we can, and that we're moving beyond a mere one-off kind of scenario, if you will. So we believe that bringing that to bear will help us create a portal to ensure that that information is centralized, and that it's also an opportunity for people to be able to find out where those services are, to be able to access them. But also it's a leverage opportunity as well for many of those, some of them faith-based institutions, some of them smaller nonprofits with less capacity, to be able to see those dollars, see those funds, see those efforts go further. So that's the next thing. The third one was improving the interface with the COVID-19 county landing page. We got quite a bit of feedback of trying to just make that more user-friendly, if you will, and also being able to link the information that's happening around all the COVID efforts for the county in a user-friendly format for the general public, that we can drive to that site, as well as being able to share not only the COVID information of what the county is doing, but where the services are. And we think that having that information or portal landing page in a much more user-friendly format would be helpful, and something that we could do sooner, quicker, and faster. And the last one is creating a resource center. As we think about all of the various populations that have been impacted that we see their needs being exacerbated. Everything from, we've talked about our children, in terms of what's happening there with distance learning. We've talked about our children from a standpoint of nutrition and meals and accessibility, not being in the formalized educational environment or instructional environment. We've talked about a lot of our senior citizens who are dealing with isolationism, who don't have the opportunity to get out, who have underlying conditions and find that this has disproportionately impacted them. There is another population that our focus group came up with, and it's really dealing with those individuals who are aging out of foster care. Much subject matter expertise with regards to some of our human services professionals brought to light that on average, we have a significant number of individuals who are aging out of foster care who are left to fend for themselves. And there were about 50 or so just in the midst of COVID who would have been released. And so we have, because of COVID, kept them under our umbrella in order to ensure that they have the supports as opposed to releasing them during this most critical moment. But we know that at some point in time, there will be a release for that segment of population, and without the ready, accessible support system, that they may find themselves in another part of our need when we have them already under our purview. So it's a matter of just trying to ensure success before we allow them to age out. But that's been something that we've had quite a bit of discussion on. Judge Adams was very, I think, supportive in that light about recognizing that this was yet another population that we had not initially thought of, because the focus truly had been on those wage earners. It had been on the children, primarily K through 12, and it had been on the seniors. But there is another population that is perhaps not as known that rises to our level of priority for us. So those are our four. Again, to coordinate the housing support for domestic violence victims, as well as those of sexual assault and human trafficking, to build out our food czar effort with regards to even some GIS mapping, to improve our interface on the county's website where there is a significant user-friendly landing page, and fourth, to look at our resource center to deal with not only the initial populations that we sought to serve, but recognizing that there is another one that has risen to the top as a priority as well, with those who are aging out of foster care. With that, Mr. Chairman, I'll answer any questions and yield back to you.
Ms. Allen, thank you for the report. And while folks are thinking of questions, one question on the housing support: what aspect of the housing support were you most focused on? Is it the availability of housing because of COVID? Was it people being aware, or people being concerned about moving into housing because of COVID? I was just curious what was the biggest need there that the group saw?
Sure. So for this particular population, because we were dealing with those who were in domestic violence, I think we all recognize that while we're in this crisis, one of the things that has come out is and I know that Dr. Wright hears it and sees it every day and is an expert on it, is the mental health piece. So that, in terms of, we were dealing with more of the domestic violence, which is a mental health issue, if you will. And so one of the things that had come out of that was we noticed that many of our victims, for lack of a better term, have found themselves now quarantined with their abusers. That we then find that child abuse has also been on the rise, and then of course the trafficking is still very much an issue, where now there is even less of an opportunity to be quote unquote rescued. And so when we thought about housing in that light, it was really around those victims as opposed to the general, where do we house people, what is affordable housing, and what do we look for when it comes to workforce housing. This was more of the quote unquote crisis intervention. So
finding available housing for all the victims of the various, okay.
And how do we keep track, and how do we keep that at the forefront? You mentioned, Mr. Chairman, at the offset of the question, whether or not this was about general awareness as well. And so it is, because again, in the midst of the quarantine, everybody's been focused on be home, stay safe. We don't think about those that may be home and unsafe. And so it's just a matter of how do we have that conversation? How do we bring that awareness to the forefront? And for those who can see something and say something, that they have the wherewithal to be able to do so.
Other questions from Ms. Allen Herring?
I do have one, and that is, are there any regional or national models that with regard to the question that was just answered, that the subcommittee is looking at that allows us to be a lot more focused and maybe more innovative than we may believe that we are today?
Yes, thank you, Dr. Dukes, for that question. There are other models, and the task force has taken into account benchmarking. We are looking at other jurisdictions, and in consultation with our partners at EY, we literally just had a training session last Thursday with our EY consultant where we were able to benchmark and look at other jurisdictions. Hillsborough County, which is really Tampa, Florida, they have proven to be a best in class and offering some, I believe, programmatic excellence in this light. And so we've had their county executive, or one of their county executives, if you will, to be able to share with us some of the work that they've been doing. So we'll be able to bring more of that specificity back to this group, where we think it may, where there's certainly alignment and where there is opportunity for replication, we will do so, recognizing that all of the jurisdictions may not be the same, but where we believe some of those things can apply here in Prince George's County, we will be bringing them to the forefront as well. There are other urban and suburban jurisdictions that we are looking at as well in terms of benchmarking, and just trying to find, not only from a jurisdictional standpoint, what may be a similar demographic, but also who just has a program that does well, whether it's a similar demographic or not. So we're looking for the best in that programmatic work, but we're also looking for similar demographics so that we can know whether or not it's something that's truly applicable for us.
Thank you.
Thank you.
No other questions for Ms. Allen Herring. Turn it over to Dr. Wright, who chairs the Health Recovery Task Force or Subcommittee. Dr. Wright.
Good afternoon, and thank you, Ms. Allen Herring, for raising the issue of domestic violence. October is, in fact, National Domestic Violence Awareness Month, and we literally just got finished hosting a press conference here at the hospital with the county executive and state's attorney around this issue. So very, very timely. I'm going to move right ahead with the 4 recommendations that I'd like to share here with the executive committee and the rest of the participating task force members today. From our health operations specific focus area, the development of a 3-year funding plan for health department priorities and needs. And we heard repeatedly from health department leadership and other folks who presented to our group about the need to, frankly, flip the constellation, or the how the health department is funded, from being 80% reliant on grant funding and 20% from general funds, to really have a much more sustainable and a much more fungible funding stream, so that the health department can be responsive and react in the way that that it should to needs like the pandemic. And this is something that we have heard throughout our deliberations, and wanted to ensure that this is at the top of our priority list of recommendations that we make in the short-term phase of Prince George's Forward. Second is the need for countywide testing. This came from our specific focus area around the next wave and continuing response needs as we stand on the precipice of increasing activity in our hospital systems with individuals in our emergency departments and inpatient environments. It's critically important that we maintain the county's ability to do adequate testing. And with the anticipated end to stimulus funding through the CARES Act at the end of the calendar year, it's incumbent on the county to identify mechanisms to maintain testing at the rate that is needed in order to continue to respond, and more importantly, to be proactive in the prevention of further spread of the pandemic in the county. That number is something on the order of 22,000 tests per week of county residents, and the goal here that is being recommended is that by the end of the calendar year that we establish mechanisms and partnerships that will achieve that goal of 22,000, in fact 22,500 county tests per week. The next recommendation comes from our equity care coordination and gaps specific focus area. And this has to do with data infrastructure and assessing data infrastructure. This is foundational. A public health entity cannot do its work without an adequate data infrastructure. And so this recommendation is designed to assess where we are with that health data infrastructure, particularly addressing how we leverage electronic medical record, how we leverage a broad platform that looks at not only what's happening in terms of acute care, but care coordination and disease investigation. And we heard directly from Donna Perkins, who leads this effort at the health department, who shared with us some of the challenges that exist in this area. And we'd like to recommend to the chairs that and the whole executive committee here that this is a foundational element to a public health response that needs to be addressed. And then our last recommendation, also from the next wave continuing response needs, has to do with the COVID-19 vaccine deployment. Assuredly, in 2021, we will be confronted with the need to deploy a vaccine. This vaccine will be a two-stage process and will involve the confidence of the community writ large, and will also involve a robust plan for distribution and getting the vaccine to obviously first our frontline workers and then to the broader community. So this involves not only the operational elements of a mass vaccine effort, but also a communication strategy to ensure that we don't have vaccine hesitancy, which is something that of concern for our community. So those are the 4 priority recommendations coming from Health Recovery. I am happy to answer any questions, Madam and Mr. Chair.
Dr. Wright, thank you. Just one quick question on the data infrastructure. You know, just thinking about how people work in different communities and live in different communities, is part of that effort, I mean, do we need to be reaching to understand what's happening and how we can get data out of, you know, Virginia, Montgomery County, the district as well for residents?
Yes, thank you for that question. That is absolutely right. What we have learned is that obviously the vaccine doesn't respect geopolitical boundaries, and it has very much been a regional situation where there have been challenges with getting data relevant to our county residents, because obviously we have residents who are receiving care at facilities out of county. We have residents whose family members are moving across county lines. And so it almost needs to be a council of governments type of approach here, where data is available and transparent across these geopolitical boundaries. So absolutely correct. We have done a good job of having the entities who generate data, health system entities that generate data within county. But to your point, our most impacted community with the COVID-19 zip code 20735, I think I have that correct, has a large number of residents who receive care in Montgomery County. And so having access to data from health systems that serve other jurisdictions and it would be important.
Good. Other questions for Dr. Wright? Go ahead, Dr.
I do have a question, maybe a few. One is when you talked about countywide testing, Dr. Wright, and you gave a number of about 22,500. Is that unduplicated, or is there an expectation that those are duplicated numbers?
in the county, and I defer to, I see Dr. Askew here. First of all, that number, the reason that 22,500 is a target, because that sustaining that cadence will allow us to test 10% of the population on an ongoing basis. And right now, I believe that is, George, correct me if I'm wrong, an unduplicated number, but the principal takeaway with that 22,500 is maintaining a cadence of 10% of population tested in an ongoing fashion.
You're on mute, Dr. Askew.
Oh, okay, George.
Can we take him off mute? That would be a question for Linda or David Stone.
Not many.
There he is.
Not many
Thank you.
Find a way to shut me up, but they did.
Okay. All right.
Yeah, no, those are of the 22,500. Some of those are duplicated. Those aren't all unique tests, but it's a small. It's a fairly small percentage. And I think Dr. Wright was right on target with respect to trying to get 10% of the population tested on an ongoing basis. And we've been doing pretty well. And that's sort of Dr. Carter's goal. His 22.5 for him is the target where he says we're testing adequately. Then it's a matter of making sure we do the appropriate contact tracing and follow-ups for folks, and that we have the ability to quarantine and isolate.
So we're going to keep you off mute because I have another question for Dr. Wright that he may ask you to weigh in as well. And it's in regard to the mass vaccine effort. Can you speak to at all how we might, through this process, work to ensure that there is that we create that kind of environment where we want to take the vaccine, particularly given the information that came out this week with regard to both Johnson & Johnson and Eli Lilly stopping at least halting some testing for a period of time?
So let me take the back end of that first. So two of the companies that are developing vaccines are in phase 3 and have temporarily ceased the phase 3 of the vaccine testing because of adverse reactions in a volunteer who has been part of the phase 3. So by definition, the assessment of that reaction is ongoing there. And what I was hoping to emphasize with this recommendation is just what you have asked about, Dr. Dukes, is that we as a community broadly have struggled with vaccine hesitancy. And it's critically important with a novel, particularly with a novel virus like this, in which there is no herd immunity. And let me say that again, there is no herd immunity. Lots of misinformation about that term. This is the only definitive preventive tool that we will have available. So it will be critically important to communicate with confidence about the vaccine, about the need for vaccination, and to reassure the public that this is in fact the tool that will protect us. And so in addition to the distribution mechanism, there also is going to be, as part of this recommendation, a need for a very robust communication strategy. We've already experienced, for instance, a decline in childhood immunizations coming through the pandemic. So this whole issue of protecting our residents through immunizations and this vaccine, we just really need to double down on that reassurance.
Didn't know if you wanted to add anything, Dr. Askew.
I was just going to say, I don't think I can add too much to that, except to channel my inner Dr. Carter. We've been having conversations with the state. We've been having conversations with our health system partners. We've already started planning on issues of distribution, storage, and all the other things that are going to take place. What I keep reminding folks of is that this is going to be a United
So
States.
Dr. Askew, I'll just ask you to hold one moment. For those of you who are not on mute, please do so. Thank you. Dr. Askew, please continue.
Sure. Just going to say that we sometimes forget that this is not a U.S. problem. This is a global issue. So the idea that this vaccine is going to get out and get to everybody anytime soon or quickly is a fallacy. This is an effort unlike anything we've seen before. So that's going to be one challenge. And the other one is, we're committed here in the county of making sure that when an appropriate vaccine that is safe is available, that we get it to our residents as quickly as possible. But we will not, under any circumstances, allow any vaccine into anybody in our county that we do not feel is safe and effective. That's Dr. Carter's mantra, and I agree with him.
Thank you. Thank you. I'll turn it back to you, Dave.
Thanks. Next, we're going to turn to the Economic Recovery Task Force. Mr. Thomas Graham is the chair of that. So, Mr. Graham.
Thank you, and good afternoon, everyone. Look, first, I'd like to recognize all my team members for all the hard work they put in addition to DCAO, Angie Rogers, the entire Economic Development Cluster, and of course, Brandon Starks, who's been very supportive. As a reminder, we had 7 specific areas of focus. Our group is about a little over 20. We went through an interview process with 9 different agencies and consultants to get to our quick wins, and now today our short-term recommendations. So the first one is improve the regulatory process to attract more economic development initiatives and businesses. That came from our job and wealth creation team. There are numerous subsets of that have to do with different policies, third-party inspections, and an array of other things. But that is our number one recommendation in this particular at this time for short-term recommendations. Number 2, analysis of local state impact fees as an impediment for future real estate development activity. That came from our real estate recovery team. There was a bit of a crossover from 1 and 2. The group really felt strongly with regards to fees that are charged to developers that can serve as a deterrent. And although the property value may be a little bit lower here in Prince George's County, that is made up by the increased fees that we charge for development. So that's our second recommendation. Our third recommendation is achieve 50% public procurement with small and minority and county-based businesses. I think this feeds off of one of our quick win recommendations that had to do with the Green Book. And it also is very consistent with some of the legislation that the county council is contemplating at this time in order to build wealth within our community through our small businesses. And within Prince George's County, majority of our businesses are small. So that is very important moving forward. And that again came from our job and wealth creation team. And our final recommendation is conduct a needs assessment to determine what additional capacity is required to support the work of the economic development cluster. Our team felt as though that group needed to have more resources to be competitive with the other jurisdictions in this area. We have more FTEs who may have more dollars committed to economic development. And if we're really to move forward through this process, it's critical that we make sure that we provide that group the resources they need, not only to move through economic recovery, but also to get through the reimagined portion of this. And Mr. Chair, that concludes our 4 recommendations for economic recovery. I'm available to answer any questions you might have.
Mr. Graham, thank you. One question on the impact of the regulatory process. You mentioned the third-party inspections. Were there a couple other high priority items on that list that your group?
Yes. So there were 5 altogether. Actually, there were 6, but 1 crossed over into fee impacts. But to go through them all, review the third-party engineering review inspection concept with a selected team of DPI staff and representatives from the developer and engineering communities to see what changes could be implemented to improve the process. That's part 1. Part 2 would be develop and publish permit/plan review steps and timeframe charts following both an in-house only staff review process and a third-party only process that realistically sets the steps and time standards that will be adhered to so the developer can make an informed decision on course to proceed with. Part C would be developing a monitoring program of both in-house and third-party performance in accordance with adopted standards to then be used to make corrections in the process that are attributable to either the in-house or third-party reviewers or the developer's engineers. Part 4 would be develop a policy to formally authorize the director of DPI to select from pre-approved engineering firms temporary engineering review staff to backfill a vacant position until such time as the position is filled with a permanent employee. Salary lapse from vacant funded positions would be in the funding source, and the DPI director would provide reports to the budget office tracking available fund balances when these measures are to be used. The final piece would be review permitting process coordination between DPI, Park and Planning, WSSC, SCD, and any other involved agencies to determine if further delegations are needed to improve review times. And that concludes all the areas under that bullet, sir.
Thank you. Other questions for Mr. Graham? If not, we'll turn to the Government Operations Recovery Task Force. Governor O'Malley.
Governor O'Malley is not available today.
Hello.
Oh, you are?
Hello.
Okay, you
Can
are
you hear
there.
me?
Okay.
Yeah, Deb, thank you. Yeah, we've had some gremlins for some reason. It's been my joy to be on this call since the first opening seconds. And so I was always there, but the technology wasn't being kindly and connecting me and unmuting me. But now I'm good to go, right? Yeah. Okay. So here are our recommendations. Some of them will sound familiar to all of you out of the Government Operations work group. One is continuity of government, COG plan that is, and getting that totally completed by June 2021. We're moving a lot faster than that on a departmental level, but anyway, we're here to talk about some of the longer term plans. So completing that continuity of government plan and amending it to, in light of COVID and the truth that we may be dealing with 40% of the workforce unable to come to work. The second one is customer-facing services, doing not only an analysis of those customer-facing services, whether it's the customer who's the developer that Tom was talking about or a customer citizen, but knowing what those customer-facing services are and then working through and overcoming the gaps, the obstacles, the barriers that prevent the county currently from providing that service in a remote fashion. And in other words, in some instances, it might be the digitization of documents, getting them off of paper so people can access it remotely. The third piece, and this we didn't talk about in the shorter term policies, was some risk management around the internal and external risks that we face. With so much of the county's work being done remotely, we need to update the IT security policy, and we need to update and create a training regimen for IT cybersecurity for all employees. And related to that, another risk internally is mental health training for employees. Given the isolation, the distance, the family pressures, the child care challenges, and all of those things, we believe we need to train up managers to ask the right questions and be on the lookout for those warning signs. And finally, is a recommendation to stand up a performance management system. I heard a lot of talk in this call about data, and people always bemoan separate silos of data and data that doesn't talk to other data and hard to get data to land on the same map. You're never going to do it unless you have a performance management system. We got to get the county out of this 1 year annual budget sort of thing and into a every 2 week performance management regimen, so that we can evaluate whether in fact we're delivering the services remotely that this county depends on. It's great that 90% of employees say they're more effective at home. Is that true? I don't know that it is, but there's an answer to it, and it comes down to measuring those, service, measuring the time within which a service is delivered or not, and being able to do that on a common platform. That's really what a performance management system would help us to do if we could not allow perfect to be the enemy of the good. Just start, don't stop, and we'll get better every 2 weeks. So that's our report. Thanks very, very much.
Thank you, Governor. And just for the record, say I'm not 90% effective when I'm at home, as opposed to work. So, but a question on the cybersecurity. Had you looked at the potential maybe as the county developed that, as Graham was so many small businesses in the county, making some of that available to them in some cases, may have the resources with cyber training and mental health training.
I haven't heard that mentioned, but I'm glad to bring it back. We're really kind of Miss Gibson is the driver of this cybersecurity train. And I'm glad to bring that suggestion back.
It's something to think about.
Yep.
Other questions? The Government Operations Recovery Group. If not, I just want to thank each of the groups, not just the chairs, clearly carrying a large load here, all the members on each of the committees and all the work you've done. It is clear from the recommendations that we're seeing today that you continue to think deeply, continue to spend real time and energy in helping think through a host of issues that we've really not had to face before, or if we've had to face, are not as critical as they are now in light of COVID. So really appreciate the effort, appreciate the creativity that are coming up. And again, I wish we had both the time and the ability to focus on every one of the recommendations that you're bringing forward and that your groups are thinking through. But again, as I said earlier, I think we need to remain focused in order to make sure that we're able to move some of the most critical ones forward instead of trying to move 50 forward and not getting this far. Let's move a smaller number forward and make sure we can get them moving. So with that, I'll turn it back over to Dr. Dukes.
Thank you. And I too want to echo Dave's comments about the continued appreciation for the work. I want to make just at least an announcement with regard to the press conference that we held on October the 5th. I think that all of you were able to see the media coverage that we received as a result of working with a number of media persons who took the time, I think, to come on the call and to listen to each of you as the chairs of the subcommittees talk about the work that is going on here in Prince George's County. I expect that through McKenna Media, we will have more of those, and that some of those will highlight each one of you as subcommittee chairs. So please be on the lookout for any calls that you may get from the representatives from McKenna Media, and to the extent that you can, we'll make sure that as they are asking you to meet with the various media, that it will accommodate your schedules. The other thing I'd like to do is to just announce that on Tuesday, October 20th at 12 noon, there will be Dave and I will be participating in a briefing of the actions today, those 38 of 47 recommendations that were accepted by the county executive. We'll provide a briefing to the county council, and more information will be coming with regard to that. And I'm believing that it is a public meeting, so certainly we'll share the information. So any of you who would like to log in and listen, you'll be able to do that. And as we continue to move down this path, we want to also make you aware that through Glenda Wilson, David Sloan, and their teams, we're going to keep all of the subcommittees and particularly the chairs advised of the work that's going on to implement those 38 recommendations that again have already been approved, so that you all are aware that things are moving, they're moving forward, and they're moving with as much alacrity as humanly possible, again, given the times in which we find ourselves. So we will continue to meet with you both as the executive committee and then individually to ensure that Dave and I are aware of where your needs are, where there are gaps and opportunities, that as the co-chairs of the task force, we can step in where needed in order to support you or be able to articulate what your needs are to those who are charged to support you in this process. I will say, Dr. Pines, I do have one more question for you. Is that all right?
Sure.
You talked about teacher resources and reallocation of those resources. Did your committee talk about whether or not there is a role for higher education to help to support that?
Absolutely.
Or to be supportive in any specific ways?
Yeah, I think there's several partnerships between Bowie State and Prince George's County Public School System, as well as with the University, on virtual learning training models to help educate the current workforce in these new modalities of learning, which is virtual, hybrid, and blended. So that's already ongoing through several partnerships, but what it is part of that umbrella of resource allocation and partnership.
I have to unmute. I'm sorry. That was the question that I had for you, and I was sorry that I didn't get in time enough to ask it while you were presenting. So I think with that, if there are no more questions, we'll continue to remind our audience that in order to review the minutes and the recording, you can go to www.princegeorgesforward.com. And if you would like to send us any questions or have any comments, please do so by visiting the email address at pathforward@co.pg.md.us. Want to thank everyone for being on the call and again for your support.
Dr. Dukes.
And I think there is something else that I'm getting the message. So Dave, I'll turn it back to you and then you can close us out when you finish.
Okay, thank you. Thank you, Dr. Dukes. I just saw that Major Riddick joined the call and wanted to give him an opportunity if he wanted to comment or have anything to say to this group. So
I didn't make myself visible just to speak, David and Dr. Dukes. I've been listening since the beginning, first on phone, and then I switched to the computer and then try to dance in between other things. Great recommendations, great work. I know the county executive appreciates you, but I really appreciate all the effort and commitment to this. And I heard some great ideas. A few of them I've been trying to tweak and push along. I hate the budget time coming up. So I got to keep people's mind off of the fact that we got a tight budget and realize that some of these ideas, we got to figure out a way to move them forward. And really some critical things. And if we can turn around and move on a number of these things, we can transform and transition into a different place. The human service, the touch on the health side, and some of the things on Rosie Heron's side. I mean, those are some great things. Economic development stuff is, I keep pushing that because I'm going, look, we get the economic development going, we'll get some money and we can turn around and build our budget. But anyway, all of it was really great stuff. The education stuff is hopefully going to really prepare our millennials and Gen Zs to a new level. And so I thank everybody for the participation. Thank you so much.
Yeah, thank you. And also, we've noted throughout here that your support, county exec support, not just with budget dollars for some of these recommendations, but all the staff has just been incredibly powerful and wonderful to work with, very, very supportive of our work. And can't thank you for that support enough either. So
thank you. Appreciate it. My pleasure. Thank you.
And that concludes our meeting for today. Again, appreciate everyone's time. Stay safe, stay well, and look forward to talking to you again soon. Have a good day.
Thank you. Be well.